Well, good morning, everyone. It is Thursday, September 24th, and welcome to training on Home and Community-Based Services, HCBS. And we're just thrilled to have you all join us. This is a great crowd. We have a lot of folks who've registered and are going to be coming in the next few minutes. And we hope this will be interactive and informative. And we want all your questions and concerns. And this is really just the beginning of many future trainings because these are complicated topics and they address, focus on different populations of the individuals that our services support, as well as the family members, as well as our service providers. And so we will be doing a number of different trainings. So if you don't get your questions answered today, please know that we'll be following up. So my name is Sonia Bingaman. I am the regional manager of the Sacramento Regional Office of the State Council on Developmental Disabilities. Our office covers the same 10 counties that Alta Regional Center covers, which is Sacramento, Yolo, Yuba, Sutter, Colusa, Placer, Nevada, Sierra, Alpine, and El Dorado counties. So the greater Sacramento region. Our office is established by state and federal law as an independent state agency to ensure that people with developmental disabilities and their families receive the services and supports they want and that they need. Through advocacy, capacity building, and systemic change, SCDD works to achieve a consumer and family-based system of individualized support services and other assistance. So a lot of what we do is talking to you and finding out what the questions are that you have and looking for ways that we can improve access to services. If it's a law that needs to be changed or improved, if it's just informing people about what the law is and helping them to understand it so they can access services. I'd like to introduce my staff person, Kathy Bryan.
Hi there. Welcome, everyone. It's good to be here. I'm the CPS2 in the office, and Sonia and I work tandem to really oversee the civil rights of folks. So happy to be here, and I will be managing admitting folks into the room and also some of the chat. So feel free to reach out to me via the chat, and I can help you with anything you might need. Thank you.
Great. So we will be using the chat box for questions and answers. We'll also be using it just for input. When Katherine asks you a question, please feel free to use the chat box to answer. And we will also launch a number of polls throughout the training. So please be ready to answer those. We'll try to do it as quickly as possible. So if you can give your answer quickly, that's great. Then we'll end the poll and continue on. So that those poll questions, I think, will help all of you know where everyone else is, and also will really help Katherine to understand what your thoughts are. So without further ado, I think we've covered all the basics. Our training goes until 11, maybe just a couple minutes over 11 if there's a lot of questions at the end. And I also want to announce that there is a follow-up training to this, which is part 2, which will really focus on residential settings. And that doesn't mean somebody living with their family home. It means living in a licensed vendored residential setting. So just to answer that question. And that's October 15th from 9 to 11. So any of you are welcome to be a part of that. Even if you're a family member and you're not sure how that affects you because your family member's living at home, sometimes it's good to hear about what are the requirements in a residential home, because maybe in the future it might become an option or a need for you or your loved one. So you're welcome to join us on October 15th. And then we realize that a lot of you are service providers and a few of you are family members. And so today we'll be focused more towards service providers, but we have scheduled a third training, and that will be December 2nd from 6 to 8 p.m. So if you are a family member and you really don't want to hear things that are more focused towards service providers, you are welcome to leave the call today and register for the December 2nd call, which will be really more focused on self-advocates and family members, okay? Or you're welcome to stay today, hear this, because it's also important for you to hear what service providers are being told, and then join again on December 2nd. So we just want to let you know about that new date. It's not been created or advertised yet, but we have scheduled it. And so that we really will focus on family members and self-advocates on that call. All right. So I would like to now turn it over to Katherine and just really thank her for her time and her willingness to be on this virtual platform and bring this information and start this conversation with our community. So without further ado, thank you, Katherine.
All right, thank you, Sonia. Thank you, Kathy. Good morning, everyone. As Sonia introduced me, I'm Katherine Weston, and I'm the Home and Community-Based Services Specialist at Alta Regional Center. Every regional center has an HCBS specialist person in that role oh, excuse me. See, here we go with technology. My phone's ringing already. Okay, turn that off. So I'm the point person at our regional center for all activity having to do with the CMS final rule. So that means I'm providing trainings to our staff, to our providers, with family members. I'm working with providers who may be making some updates and changes to their services. I'm working with providers who are receiving funding through the HCBS compliance funding grants through DDS to make some of those changes. I'm meeting with providers to talk about preparing for the self-assessment, and that's what I've been doing for the past couple of years, and the self-assessment process just completed, and I'll tell you guys a little bit more about that later. And I've been focusing a lot on person-centered practices as well. Person-centered planning is such an important part of the way that services are designed and provided, and it's something I feel like we really can't get enough of, to talk about what it is and how we do it and how to make sure that we're doing it well. I've been going through the process to become certified as a person-centered thinking trainer with the learning community, and hopefully, you know, as we all get adjusted with the remote learning environments, we'll be able to start launching some trainings with that within the next year. What else can I tell you about myself? I have been in this field since about 1997. My background is working with adults in the day program setting. I worked in multiple different settings in Southern California and Northern California. About 11 years ago, I came to the regional system and have really enjoyed that as well. I spent 3 years as a service coordinator at Regional Center of the East Bay and 3 years as a service coordinator here at Alta. And then I came to the Community Services Department, where I was doing initially vendorizations with a lot of adult day programs, as well as transportation, interpreting agencies, you know, various things. And then it was about 3 years ago that I stepped into my current role, just focusing on this final rule and the implementation, making changes, understanding, you know, how to support our providers, our staff, our families as we look at what the federal requirements are and make sure that not only are we meeting those standards, but that we're doing the best that we can do. You know, we want to provide good services. We want families to be supported. We want individuals to be living full lives. So taking opportunities to see what does that mean and how can we do it better, I think is really valuable. So today I will be sharing with you guys what does the final rule say exactly? What is it about? I want to make sure to answer a lot of your questions. I love questions, and help you feel more confident that you understand what are we doing, what is this about, and not feel anxious about what this may mean for the future. So I first of all would like to share my screen with you guys and share where you can find resources on the Alta Regional Center website. As I've been finding different handouts, trainings, I developed an FAQ. I've been adding it to our website. So I'm going to go ahead and share that for you now so that you'll be able to find this as well. Okay, hopefully you're seeing that. Okay, so if you are not super familiar with Zoom, I think we're all learning as we go here. If you would like to see what's being shared on my screen as well as my video as I'm speaking, you can select View Options and then select Side by Side. All right, I'll give you guys a second to do that. So this is the website. We've got a lot of great links for family members, service providers, information about eligibility, self-determination. I'm going to scroll all the way to the bottom. I'm trying not to go too fast to make anybody dizzy. So at the bottom, there's the black background with the white letters. If you look at resources, CMS final rule, and HCBS, you're going to want to click on this, and that will take you to a link with various resources that I have posted. Right? Hopefully that's helpful for you guys. If you have questions in mind already, wonderful. I would recommend if you have questions that have to do with yourself individually, a family member individually, a specific individual situation, maybe you can pull up an email and start typing up in the body of that email, and then when we're done you can just hit send and then I can respond to you directly. If you have questions that are more general or broad and might relate to a lot of the different participants, go ahead and enter that in the chat box and we'll make sure to get to that as well. Okay, I think with that I will take you to our PowerPoint. Okay, are you guys seeing my PowerPoint? Sonia, Kathy, you can give me a thumbs up. We're looking good here. Okay, great. So here's my email address. I believe it will also be entered in the chat box for your convenience. We are going to start out with kind of getting to know one another a little bit, and nothing too detailed, but just to see, usually in a room I'll take a show of hands, right? Just to see who am I speaking with, what is the familiarity with the topic, are we going very broad, are we going more specific? So we're going to do a poll. How familiar are you with the CMS final rule requirements? You might feel like, I've heard the name, but I really don't know anything about it. Maybe I've heard a little bit about it, but I feel like I still have some questions. Or man, maybe you feel like you could be teaching this training. You've studying it so much.
People are filling it out. We're going to just wait a couple more seconds.
Yeah, thank you everybody for your participation.
All right, let's get to 60. We need 3 more. Okay, it's slowed down. So let's go ahead and launch the end the polling and share the results. Kathy.
Okay, so it looks like 33% of you, 1/3 are saying, I'm not at all familiar with this topic. I really want to learn more. 51% of you are saying, I'm somewhat familiar. And 18% very familiar. So we've got people kind of all across the board, which is fantastic. And for those of you who are feeling more familiar, I hope that you will be also encouraged to share some of your chat box as we're discussing some of the different requirements. If you've made some changes in your setting or you've observed some changes that have taken place that have worked really well, that might be good to share with others, please be welcome to do so. All right, we're going to move on. Now, please share with the next poll, what is your role? Are you a service provider? Are you a direct care staff? Are you a family member? Are you a self-advocate? Are you professional? And Sonia will be bringing that up momentarily. All right, it just popped up for me.
Rashima, if you could mute yourself for a little bit, that would be great. I thank you so much. Just hearing some background noise there for right now. Thank you. Katherine, could you say something so that we can see if you show up as the speaker, because we're on speaker view?
Okay, can you hear me?
Oh, there you go. Okay, yeah. All right. Oh, we got 60 people that time. Okay, let me launch the results.
Okay, so we have 47 people who are service providers. 25% professionals, probably a lot of regional center staff here, I'm guessing. 25% direct care staff, so working for one of our vendors. 12% family members, and 3% self-advocates. Thank you, everybody, for being here. I hope that you feel you will find something that answers your questions that you have, and please reach out and let me know exactly what's on your mind if it isn't covered during our training today. All right, so let's go ahead and get started with our topic here. So I want to tell you about the waiver. The Medicaid waiver. Where did the CMS final rule stuff come from? What's the background and history of it? It started with a little girl named Katie Beckett. Isn't she cute? She's really adorable in this picture. Katie Beckett was a girl born in the 1970s, and when she was very young, she became quite sick with encephalitis. She had to go to the hospital. She needed intensive care. She needed a lot of treatment. And obviously her family was very concerned about her. Fortunately, she recovered to the extent where she didn't need a hospital setting to provide her care, but she still did need a ventilator, which could be provided in a home setting. It didn't have to be in a hospital. However, there was a catch. Medicaid would only fund her care if she was still in the hospital. So now the family's in a quandary, right? You want to bring your little girl home, you're happy she's stable, but how are we going to pay for this treatment if she's not in the hospital? We're doing this at home. So her mom was a fighter and an advocate, and she went to President Ronald Reagan and talked to him about Katie's story. And she told President Reagan that Katie could be treated in a home environment. She could be cared for at home. There wasn't any reason she needed to be in the hospital. She would be surrounded by family and friends in a comfortable place that was familiar to her. And in fact, it would cost 1/6 of the amount that it would cost to take care of her in the hospital setting. So Reagan was very supportive, especially when you find out, oh, this costs 1/6. That's great to be saving money and still providing someone the care that they need. And so that was the Katie Beckett waiver. It was actually named for her initially. Over time, that became known as the Medicaid waiver. So basically what it's saying is that we're waiving the requirement to be cared for in an institutional setting, such as a hospital, in order for the federal government to provide funding. Now, many of you might have heard of a Medicaid waiver, or I'm on the Medicaid waiver, but not know exactly what that means for you specifically. It's saying that the federal government can provide funding for services to take place in a community setting rather than in an institutional setting. So where there is funding, there are some expectations. Let me see if I can move on to my next slide there. Okay. As I'm going through this presentation, you're going to hear a lot of terminology, a lot of letters, HCBS, CMS, and I want to give you guys some definitions to know what exactly I'm referring to. So HCBS, this refers to home and community-based services. These are services provided in a person's home or community rather than institutions or isolated settings. So this is part of the Medicaid waiver. So settings where the setting is not considered home and community-based would be an institution, a nursing home, institution for mental disease, ICFs, hospitals. So any of those, we would not expect those to be HCBS services. They're designed differently and they're funded differently. Pretty much every service that's funded through the regional center is considered an HCBS service. Other than ICFs, I think pretty much everyone. So there is an expectation that it is supporting someone to be at home and to be part of their community. CMS, this stands for Centers for Medicare and Medicaid Services. This is the federal agency that oversees that distribution of funds through the Medicaid waiver program. So it's the CMS regulations that are in place, and the change that was made to those regulations is referred to as the final rule. So the final rule is a change that was adopted in 2014. For a while, we were calling it the new rule, but now that we're in 2020, it's 6 years after it was initially adopted. We've got a kindergartner here, right? 6 years old. It's not so new anymore, but we are still in a transition process, and there's still things that we're learning, still in different places and changes that may need to be made. So it's good that we're still talking about this. So these were changes to the regulation about the requirements in order to qualify for funding. This is applying to settings where services are provided, both residential and non-residential. And as I just mentioned, HCBS services, it could even be services that are not provided in a specific setting. It could be independent living support. It could be respite. It could be therapy. Those would all be considered HCBS. It's not just a specific setting where that's taking place. Okay. So, because we would like to continue receiving the federal funding towards services, we want to make sure that our service providers as an agency are going to be aligning with the federal regulation and qualifying for that funding. We receive funding from the California state budget for services when that goes to POS authorizations and that kind of thing. We also receive reimbursement to the state funds through the federal government through CMS. So when they're saying changes are taking place, we're paying attention, right? So what we're seeing is some people may already be doing what is expected. Some providers may need to make some updates to their services. So there is time for people who do need to make some changes. That's extended through March 17th of 2023. We'd initially been given a 5-year time frame for all of the states to create a plan how they were going to assess their services settings and make any necessary changes. So as time has gone on, we've seen 5 years is really not a lot of time when you're looking at how big of a system we're working with. And so we're in the process of developing that state transition plan. It's going to be finalized after providers are assessed, and then there will be rolling out changes that may need to be made. So there's kind of been a shift that's taking place. We don't want it to be about good providers and bad providers. It's not that things were wrong in the past. It's been kind of a shift along a continuum of less integrated in the community to more, as much as possible. Although HCBS, home and community-based, it's supposed to be an alternative to an institution. What CMS had realized was that there may be funding for HCBS in a setting that it's really not a community experience. It might be called community-based, or it might look like it's in the community, but if people are isolated or segregated from the community at large, is it truly a community experience? Is it doing what it's meant to do? So there's kind of a move away from program more towards support and really making that individualized as possible. So what does that mean for us? Now, the final rule is bigger than just us in the developmental disabilities service system. It covers multiple waivers, it covers multiple types of services, but for us here at the Regional Center, our services are going to be assessed and any changes directed through the Department of Developmental Services. There are thousands of providers in our state that fall under the final rule, and that's a lot for DDS to be taking a look at. So, as I mentioned, there's a transition period for people who have been vendored, maybe under one set of expectations and may need to make some updates. Any new vendors, any new service providers that we are contracting with, we will be expecting that they are designed to meet the requirements from day one. So this sounds an awful lot like I'm just talking about providers, right? And I really don't want you to think this is only for providers to be learning about or having to be concerned about. The focus on providers is coming from a place where The provider services are what's specifically being assessed. The providers are the ones that have to show that their services are in compliance with the final rule. But all of that is in the context of the needs of the individuals that they're serving. So you can have two providers who have a very similar design or location or setup, but if they have different needs with the populations that they're serving, they can be assessed differently. So providers will be listening through the lens of maybe making some changes or updates to their services or procedures. If you're an individual who receives service or a family member, it's really important that you're thinking about what is really important to you. What are your goals? What are the things you need to be able to make progress on your goals? What do you want your future to include? And make sure your team knows about it so that they can be supporting you and writing that into your plan. Service coordinators, you have a very important role in supporting the team to identify those goals, short-term and long-term, who's going to be responsible for what, and then documenting those things in the IPP. The IPP is really the contract, right? It's the standard that we're looking at. What is going to be provided? And if the provider is implementing that IPP well, it's easy for them to show that they are compliant with the final rule. And I really encourage all of you, when you're talking about services, it's not just the setting, it's the intent. What is the desired outcome? What is someone going to learn or receive or get out of this service being provided? Okay, so we have come to our first question and answer session. I'm going to stop sharing my screen. If you have a question about any of that, comment about any of that, I would love to have you enter that in the chat, and then Kathy can share with us.
If you have a question, you're also welcome to just unmute yourself and ask it.
Sure, that'd be great too.
There was a question in chat about whether this was being recorded, and it is being recorded, and we'll share it out later. Looks like there's a question there, Kathy.
Yeah, so Virginia has a question. So for a day program, what sorts of things will change?
Well, here's the answer I'm sure you were looking for. It depends. It may depend on how the day program was designed, and it will also depend on the needs of the individuals that participate there. So one of the examples I like to give could be about a behavior management program that is based on a setting, a site-based program controlled by the provider. Now, some individuals with the regional center may live on their own, work a full-time job, own their own home, drive a car. They may be very independent, and a setting such as a behavior management program on a site might be very restrictive for them. That would definitely not be a fit, and it wouldn't be appropriate. And if someone is expecting them to stay on that site rather than be out part of the community working, that would be a concern, right? Now, I've met other individuals who may have a lot going on. They may have anxiety, they may have some challenging behaviors, maybe we're trying to get medication levels stabilized, and it is a challenge just to even get out of the house without putting themselves or others in the community at risk. For that individual to leave the home and come to a site and spend time with peers, that may be a huge leap in growth and independence for that individual. So what we want to see is that the day program is not limiting the participants. We want to see that the day program is empowering them. And what that is going to look like is going to be different depending on what those individuals' goals are. So this is why the IPP is so important, because that's really going to identify the needs and the goals and what the plan is going to be for that program. I hope that's helpful.
Okay, does anybody else have a question? If you want to ask it just out loud with Katherine, that's fine, or you can put it in the chat, and I'm happy to let her know that too. Okay, we have another question, Katherine. Who will be working with the RSP throughout the change of HCBS other than the Alta SC?
Okay, so for a residential service provider, if there are questions or changes that need to be made about an individual's plan, you would talk to the individual service coordinator. That is a planning team discussion. If there are questions about vendorization, program design, services, you would talk to your community services specialist, which at Alta might be Denise Hopkins or Stephen Richardson or Odelia Harrison-Johns or Isabella Serrato. And you're always welcome to reach out to me as well. I'm here as a resource for you.
Okay, we have another comment. Chris says, since the distinct, oh, I have to scroll up because it's a long one.
You want me to just read it?
Yeah,
Yeah, that'd be great, Chris. Thank you.
Okay, sorry.
That's okay.
My wife accused me of being too wordy all the time.
Oh,
okay, so it's just
we
this
appreciate
is like this is not like well, anyway, I'm just gonna say it. I'll just read it. Since the distinguishing factor for inclusion is really related to individual needs, I was just wondering if this topic isn't more of a question about whether or not the individual ought to be in that given program, not whether or not the program ought to exist. As in, I've kind of seen a big push for providers to rethink their programs, and maybe they ought to, of course, but ultimately the program itself staying open in its current form seems to be a question about whether or not like a critical mass of individuals find that given program to meet their needs in an HCBS compliant way. Am I thinking about that right?
Yeah, I think there's a place for both, right? There may be times when the planning team sees this environment really is not a fit for this individual given the goals and the needs that they have. And I think there is a value in some services being somewhat specialized so that they can really do what they do well. And it will be very clear if it's a fit or not. For example, an art program. An art program is not going to be for everybody. If you're not interested in art, if you don't want to be an artist, it's not going to be for you. To ask them to offer every curriculum, they're not going to do everything well. But for someone who does have that goal, that could be a very good fit. We don't want to see programs that are limiting opportunity, that are maybe falling back on, well, that's not what we do. You know, we're not a work program. Okay, maybe you're not a work program, and not every program has to be a work program specifically, or, you know, a supported employment service, but there may be individuals who have interest in working. How are you going to be supporting those individuals with that goal? Perhaps it's working on some soft skills, some of those pre-employment training skills, getting ready to be successful in a work environment, some pre-vocational training. It might be training on some actual job skills that you can take and get hired to do. It might be developing something, you know, as like a micro enterprise service or an Etsy shop where you're selling the things that you're creating. It might be working with your planning team to identify, okay, these are the things that we need to get in place before we're going to successfully transition to a program that is focused more on work. So how does the service and setting fit with the greater goals you have, you know, for your life? What are the anticipated outcomes there?
Okay, Katherine, we have a couple of other questions. How does someone get started in changing over, like a residential service provider or a day program provider? How would somebody change over to HCBS?
I would encourage you to reach out to your community services specialist for a vendored service provider. They're the ones that are going to know what's in your current program design and can assist you in how to make updates. You might need to, I mean, if it's a really huge change, you might need to revise that whole program design. You might need just to do an addendum to say we're adding this to the things that we've been doing in the past. And if you're not sure who that is, feel free to reach out to me and I'll send you their way.
Yeah, because the next comment or question was, will every regional center now have a community services specialist that will be available to a consumer's parent/representative?
So regional centers do have community services departments, and those are the folks that are working with the vendor service providers, excuse me. So developing program designs, filling out vendorization paperwork, communicating changes to requirements, policies, procedures for vendors. So that is not going to impact the individual planning team. If you are a parent or representative, I would encourage you to talk directly with that service coordinator.
Okay. And then Hillary has a comment. What is about creating a form for a newly proposed CMS rules for the home and community-based waiver services? Do you have a sample of that form?
I'm not entirely sure I understand the question. What is it that you want the form to do? And feel free to unmute yourself if you'd like to just ask.
I believe they said the form so that the client can make choices. Like if they want a roommate, they want a door to be locked, they want a key to the facility, all those options that is in this final rule.
I would encourage the planning team to talk about all of these different kind of things when they're meeting for the IPP and to include that in your IPP documentation. This is really helpful for service providers to know what is expected and to be able to have kind of that outline for what it is that they're going to be delivering. Service providers are welcome to develop something on their own just to get to know people. Maybe when someone is moving into a care home, you know, what do you like to eat for breakfast? Do you prefer to have a roommate or to be on your own? Do you like to get up early or stay up late? How do you like to celebrate your birthday? What do you like to do for fun? These are things that when you know this about someone, you can help them you know, develop schedules and have the things that are part of their life that they really enjoy and are important to them.
Okay.
And we'll focus more on residential settings in the next training as well.
Okay.
All right, Katherine, I think we should move on right now.
Okay. Can we do the one that just popped up, because I would really like to answer that one.
Yeah.
So Brenda Huff said, this is all about person-centered training, right? Thinking outside of the box to enhance our client's life. This is based on their abilities and SC determined goals. Well, I appreciate you for bringing that up, because the more I've looked at person-centered thinking and person-centered practices, I really do think it is all about person-centered planning, which is through the Lantern Act. This is what we're supposed to be doing. Our IPPs are supposed to be developed through a person-centered planning process. But I think there's an opportunity now to really look and see, are we doing this well, and are we doing it the way we want to? And even though we've been doing this in California, it doesn't necessarily mean it's been happening nationwide. So for the federal government to say, this is our expectation that person-centered planning is taking place, if you look at the details of the final rule, I think those are ways they're trying to be able to measure, are we really doing person-centered planning and doing it well? All right, so we're going to go on with a poll, and we'll come back to more questions in a little bit. So feel free to keep entering them. But right now we're going to ask, what does community mean to you? What does the word community mean to you, or the concept of community? Oops. And Sonia, for some reason, when I shared my screen, I couldn't see the poll anymore. So would you be able to read the results of it?
Sure. Yeah, people are still filling it out. And you can answer more than one option. And we realize if you're calling in on the phone, it's sometimes hard. You can't participate in the polls. So the question is, what does being in a community setting mean to you? One option, not being in an institution, not being at the provider's site, being in places I like to go, or being with people I relate to. And I'm going to end the polling and share the results. Can you see the results right now, Katherine?
Okay, let me unmute myself. Yes, I can see the results now.
Okay.
Okay, so not being in an institution, 40%. Not being in the provider's site, 13%. Places I like to go, 68%. And being with people I relate to, 57%. This is kind of a trick question, I think, because it could really be any of these. If you look at the requirements for a community-based day program in California Code of Regulations, Title 17, a community-based day program means something that is not in an institution. That is really the only definition that it gives to being community-based, which is pretty broad, right? I think in conversation, when we're talking with one another, we talk about going out into the community, and that means leaving the provider's site to go out and do things out and about. Now, driving off of a site doesn't necessarily mean in and of itself that you are participating in your community. It doesn't mean that you have relationships in the community. It means that you are, out and about, I guess. Being places I like to go. That's, I think, more of a sense of what we think about community. Like, we might go to the community center, we might go to the park, we might go bowling, to the movies, to our friends' houses. Those would all be out and about in the community. And being with people I relate to. I really like this because this is kind of capturing the sense of community with relationship. Sometimes community isn't as much about a place as it is about those interactions you have with friends, family members, and people you might see on an ongoing basis. You might have your favorite coffee shop and the barista there knows your name, they know your favorite order. You might walk in and they start making it before you even go up and tell them what you want because they know you so well. That's community, right? It's being known and it's having relationships with other people. You can think about community as things that, or people that you have things in common with. So if we were in person, I'd ask you all to raise your hand. If you love photography, I love photography. I love to take pictures, pretty pictures, nature, portraits of my kids, that kind of thing. When I meet another photographer, we start talking about what kind of camera do you have? What's your favorite lens? What about this f-stop? How about composition? We can start talking about these photography related things, and we may have met 5 seconds ago, but now we have this sense of engagement and relationship because we have this thing in common. You might be a member of a church or synagogue or other community organization where you see people on a regular basis and you're part of something that is bigger than yourself and you have a sense of community there. You might be there for them and they're there for you. There may be online communities. You might have a sense of connection to people that you've never met in person, but you're able to support one another through your conversations via social media, right? So when we're thinking about people who receive services, it's not just about not being in an institution. It's having relationships. It's having people that you have things in common with, people that you can trust and rely on, places that you go and you have meaningful activity. It could be work, it could be fun. There's so many different ways that you can approach this. So person-centered planning and that individualized service is one of the main components, and then I think the other is inclusion. So as we talk about the more specific components, I expect you'll see them kind of fitting into one or the other of these. Okay, thank you. So the first requirement has to do with settings. Settings where services and supports are provided must be in integrated and non-isolating settings. And rather than what specifically does that building look like, it's going to be based on the individual experience. So when providers are assessed, the stakeholder feedback is so important to say, I do experience a sense of community here. They are supporting me to be a part of the community at large, rather than I have to stay here, I'm stuck, I'm isolated. And it's interesting also to consider that what is considered isolating can be different depending on the person. Depending on someone's personality, how they relate to other people. What an introvert considers isolating may be different than what an extrovert considers isolating. right? I've heard it said that the loneliest place can be in a crowd. So maybe a place with a lot of people out and about isn't the most non-isolating place for someone. So having those conversations within your own team, where do I thrive? How do I connect with other people? How do I participate and experience relationship? These are the things that we want to be supporting. So when we are working with providers, maybe a new day program vendorization, we'll talk about ways to design their service to have a setting that is integrated with the surrounding community, that their services are designed to provide people the same degree of access to the community as anyone else in that community. So not all communities are designed alike. There may be different activities and opportunities in downtown Sacramento as there might be in Yuba City, and that's okay, right? It's the same that you and I might experience. You know, if I'm going to be a fashion photographer, I love photography, right? I'm probably not going to hit it big in Sacramento. I might move to Los Angeles or New York or Paris to have those opportunities. But when people are receiving services, we want them to have the same access as anyone else in their community, as their neighbors, their peers. We want to see that we're fostering opportunities for relationships, which foster that sense of belonging. Activities are based on participant choice. They should be relating to their IPP goals, and that we're promoting and not discouraging community participation even when we're selecting what type of location to plan that setting. Settings that isolate, we've talked about that a bit already. I'm going to go ahead onto the discussion about person-centered planning. So a lot of times people will have conversation with their team about what they're looking for in a service setting, what they want, what they need. It's not always captured as well in the documentation. And this is something that will be very helpful going forward, starting to track those things. What are the goals? What are the things we have to have in place to get there? What are the steps along the way? For example, if someone says, I want to get a job, a lot of times a service coordinator may refer that person to Department of Rehabilitation, who can help that person get a job. But we also know that Department of Rehabilitation has expectations about experience, responsibility, that that person is going to thrive and be successful in that job placement. There may be some training that would be beneficial before that referral so that it's going to be successful. So with all of that in mind, when I'm choosing this day program over that one, we're choosing this one because they're going to assist in providing that training that's going to help me to meet that goal of getting a job further on down the road. So it all should be connecting. Now, if you ask that person, what do you want to do? I want to work in the community. Well, now you're at this day program. There's a mismatch there, but the IPP is going to connect the dots between this is going to provide the training on the skills that are needed for this person to be successful in their goal. So the first of the 5 main components that apply to all settings in the final rule has to do with community. It talks about that the setting is integrated in and helps individuals to access the community. Regional center clients must have the same access to the community as anybody else. So we can talk about services. We can also talk about activities. Services would be getting a need met in some way. This could be going to the gym, it could be getting a haircut, going to the doctor, getting your nails trimmed. These are things that are services. If those are taking place during day program time or through care home setting support, are we supporting people to get that need met the same way that you and I would? So are we supporting them to go to the same gym, to the same hair salon? Or are we replicating something that is already available out in the community and making it limited to people with disabilities? We really don't want to do that because it's segregating and it's limiting. I had a day program provider approach me with an idea. I want to provide good options and good health for my participants. I'm thinking about starting a yoga class in my day program. I'm like, well, that sounds pretty cool. A lot of people like yoga and may find it beneficial. Here's a question though. Are there other yoga classes in the community for everybody that the clients could participate in? Oh yeah, I could look at that. So one way is recreating something that is already out there in the community. You know, the other option would be the day program staff are supporting the clients to participate in their own community yoga class. Now, is it going to be for everybody? Maybe, not necessarily. We don't know, right? It depends on the individuals that are interested in yoga. Maybe if someone has never done yoga and they're very anxious about trying to do this in a public setting, it might be helpful to have some practice sessions back at day program to gain the skills, gain the knowledge, gain the confidence to be able to go out there and feel relaxed and happy to participate in that. It really depends on the individual, right? So that's where it comes down to that individual planning, individual settings. It's not wrong to have a yoga class on a day program site. It's not saying you can't do that, but are we going to do that instead of accessing the community yoga class? What is it that we're trying to do here? Next one. The setting is selected by the individual from among setting options as documented in the person-centered plan. We want to make sure we're capturing the plans and the needs for the individual, and not just who is the service provider going to be, but what is really important to this individual that we need to make sure happens for them. One example might be, I talked to a care home provider about their services, and they were very confident that they were meeting all of these different requirements. And they told me that to help the client save money, they would cut all their hair for them, and said I gave them all the same haircut. And you know, you could even tell they live in this care home because they have this haircut. And I was kind of taken aback, like, how is this promoting independence and choice? Well, the clients want this. This is what they're asking for. This is their preference. As an observer who does not know the residents of this home, I don't know if they want this haircut or that haircut. I don't know. Maybe they really love saving money and looking alike. Maybe they're into that. But if they don't, are they being given a haircut that they don't want, and now they're being associated with a setting for disabilities? I was kind of uncomfortable with that. And there's really no way for me to know as an outsider, you know, unless there are things in the IPP that says this is what kind of haircut the person wants, or who they want to spend their time with, or how they want to take part in certain activities. So it's not unless we know through the IPP that we can assess, is the provider supporting them or maybe imposing their own decision on somebody else. Number 3 has to do with an individual's rights. Rights to privacy, dignity, respect, freedom from coercion and restraint. Hopefully nobody is waiting until March 17th of 2023 to do their best to be protecting individuals' rights. This is something that has always been very important. And I think the reason it's in here is to have an increased accountability, maybe a better way of looking at making sure that this is happening. And to see if providers have plans. How are you training your staff? You know, is this part of your training regimen? Is this something that we're reviewing regularly? Is this something that you're talking with the participants about so that they know what their rights are and are able to stand up for themselves? We want to see that people have privacy when they are having meetings, when they need to use the restroom, when they're having discussions about their plans, that's done in a confidential way. Are we supporting people with dignity? You know, people may not be aware of others' perceptions of them, but are we supporting them to do their activities in a dignified way? Are we respecting one another and treating one another the way that we would want to be treated? And freedom from coercion and restraint. And this is really important to think about coercion, not just as, I mean, we're, you know, not locking people in settings, but are we also pushing people? You know, when I see challenges when we've got people in ratios, we're in a group of 1 to 3, 1 to 6, people may have different ideas and preferences about how they want to spend their time, where they want to go, that kind of thing. Are staff assisting them to negotiate, to come to an agreement or take turns, or people being pushed into doing something maybe that they don't want to do? You know, your 5 other participants, they all want to go have lunch here and you want to go lunch there. Are we coercing them into going along with the bigger group? That's really not okay. We want to make sure that people are supported and feeling respected. Number 4 talks about promoting independence and making life choices, including daily activities, physical environment, and with whom to interact. This is huge. This is really about respecting people to be able to make choices about what's important to them. How do you spend your time? Do you want to go to day program? Do you want to retire and stay home? Do you want to spend time with certain peers but not with others? Maybe you like your housemates, but you don't necessarily want to also spend all day with them at day program too, right? Maybe you prefer to have lunch by yourself and have some peace and quiet and relax while you're eating. Maybe you prefer to have a big group and be very social and rowdy. People have different preferences. So we want to see that providers are designing their offerings for daily activities based on individuals' needs and preferences. That they are able to have choices about who they interact with at program and in community settings, that activities are of interest to them and also correspond with IPP goals. And we want to also see that where someone does need some support, that doesn't take away from the rights of other people. So if one person may have a doctor's order about what they're able to eat or not eat, does that impact the other people in the same setting? Or are they able to make their own choices still as well? Number 5 also talks about individual choice regarding services and who provides them. I see this one kind of focusing more about the individual service provider. Is this the place where you want to be? Are you comfortable with the staff that are supporting you there? Maybe I'm someone who needs some assistance changing clothes. I might prefer a female to a male to assist me with that. Am I able to say this person and not that person, you know, given that there's enough staffing? If there's a concern, if there's a grievance, is there a grievance policy in place that people are familiar with and are utilizing? You know, I know that on the community services vendorization side, we ask providers to include that in their program design. How are you going to respond to grievances? That is a part of every program design. Now, that doesn't mean that people are always utilizing that process. Maybe they don't know that it exists. Maybe they feel uncomfortable raising a complaint or a concern. I always encourage providers to be teaching this. It's a wonderful self-advocacy skill. I know that providers are always working with people that have a concern. You know, anytime you have more than 2 people, you've got opportunity for miscommunication, differences of opinions, these kind of things. And service providers are frequently involved in resolving that. Having a system in place that's documented is really helpful for both the individual and the service provider as well. So those requirements all apply to all of the settings that services are provided. There are additional components specifically for residential settings, such as those board and care homes that are licensed. We'll go into these more in depth in that October training, but just so you know, they cover topics such as having legally enforceable agreements, privacy, having a lockable door on the bedroom, being able to choose a single room or choice of roommates, furnishing, decorating the living unit, controlling one's schedule, having access to food at any time, and a right to have visitors at any time. So if you're not a care home provider, it's still good for you to be aware that people have these rights. If someone's coming to you and saying, you know, I would really like to have, you know, my friend come over at 8:00 p.m., but my provider is telling me that's not allowed, that might be a conversation with the service coordinator. Well, look, what's going on there? Is there, you know, another concern or plan in place, or is this something that could be considered a rights violation? So we've been talking a lot about rights. That can raise some concerns sometimes when you've met someone that may need some support or can't handle certain levels of independence safely. We want to make sure that we are assisting them with care with supervision when needed. Health and safety is always important. So what do we do with the final rule? We're not throwing away reason here. We're still going to be providing support that people need. So it's written in as flexibility to the final rule when there is a need that's assessed. So this is the planning team. It may include a physician or service provider, but there's something that has been discussed and recognized by the planning team. That need is described and addressed in the person-centered plan, and that need is reviewed regularly. So this is very appropriate when you may have a person you work with who's diagnosed with Prader-Willi. That person may not be able to safely have unlimited access to food. You know, that is something that is recognized. There may be a doctor's order in place with some kind of prescribed diet, calorie count, that kind of thing that the providers are expected to be delivering for the resident of that home. Now, because that's that individual need, are we going to lock up food from everybody that lives in the same home? Not necessarily. They have access to food at any time, but for that one individual, we're going to make sure they have the support that we need. It's got to be documented, and there's got to be a review of that on a regular basis. If someone made a maybe not the best decision about something when they were 14 years old, is that something that's going to follow them in their documentation throughout their lifespan? Because they made this bad decision, you know, you're never going to be able to have an opportunity to be independent. You know, how many of us have made some mistakes that we don't want on our permanent record? You know, we wouldn't want us following us through our lifetime. We want to have the chance to learn from our mistakes and to be able to grow. So yes, provide support where it's needed, but to come back a year later and say, this really isn't an issue anymore. We've kind of resolved this. So being realistic about providing support that is needed, as well as, you know, fading back that support when it no longer is needed. Okay, I think this is a good time to take some more questions. I really, you know, love seeing hands go up. I love seeing questions come in. So please
Katherine,
add your questions now. Yes.
Yeah, does anybody want to speak up and ask questions first? And then there are a couple questions in the chat.
Okay, so one question I see has to do with the challenge of transportation. When there's a day program based at a site, if you're going to go anywhere else, you need to have a way to get there. So yes, that can be a challenge. That's something to discuss, I think, with your staff there, as well as your planning teams, what's needed and what is available. So depending where you're located, you may have different options, right? When we are vendoring a new day program, we really encourage people to look at what is your access to public transportation. Are you able to walk out and get on a bus? Are you planning to have vans? Are you able to walk to some community locations? So if you are not located in walking distance of places that participants may want to go or to public transportation, you are going to be reliant on staff driving, which is an option but has some limitations. You could look at relocating. You've got different options there too. So feel free to reach out to me individually about your specific locations. I know in the past, DDS has offered some funding opportunities to request things like vans, like, oh, if we could just get one more van, we could do a lot more out and about. That's going to be announced year by year when it's allocated in the state budget. So I frequently will give those updates at vendor forums and that kind of thing.
Hey, this is Rick Hodgkins here, not Hodgkins, Hodgkins. Someone typed my name wrong when they helped me sign up for this. About Prader-Willi syndrome, thank God I don't have it. I have something similar, but I'm not hungry all the time. It just takes me a while to be satisfied. So I'm able to eat till I feel satisfied. But I have similar symptoms. Anyway, rather than put someone with Prader-Willi syndrome, you know, we really need to find a cure for Prader-Willi syndrome, because they shouldn't have to suffer and be treated like criminals. But that's a subject for yet another day and yet another time. But rather than put people with Prader-Willi syndrome in the same home with people without Prader-Willi syndrome. I've watched a lot of documentaries in the about people in the UK with Prader-Willi syndrome, and that in the UK that they actually have homes for people with Prader-Willi syndrome. They put them in the homes with other people with Prader-Willi syndrome. I don't know if we have special homes available for people with Prader-Willi syndrome here in our state or in our regional center catchment area, but it's worth looking into, because that way no one is jealous. Everyone with Prader-Willi syndrome lives together, and it's, you know, that way no one is jealous. Everyone, you know, has the same, it's just better that way. That way you know, you don't put someone with Prader-Willi syndrome in the same home with people without Prader-Willi syndrome, Prader-Willi or Prader-Willi. And then, did you get my email about what I said earlier, Katherine?
I'm going to check my email as soon as I finish this.
Because Ronald Reagan was the governor. Ronald Reagan was the governor, not the president.
Okay, thank you, Rick. I really appreciate what you said. I think that really goes back to the need for individual choice. You know, there's definitely advantages of serving people in a setting together when they have similar needs for support. And you gave a really good example of that. And we also want to make sure this is the setting where everybody wants to be there. They want to be together. If someone is not happy with their housing situation, they really should talk to their service coordinator and start talking about making some plans for what would be better, you know, what would meet their needs and their goals.
And Katherine, I have another question in the chat. Legally enforceable agreements regarding that. Does that mean people have to have rental agreements?
If they're renting, that may be the case. I will say this, we'll cover this a little bit in the residential training. For the purposes of regional center funded board and care placements, we're looking at our admissions agreement currently as meeting that standard of you know, having that enforceable agreement. We do want to make sure that people are understanding the things that they're signing. You know, this is to kind of normalize the landlord-tenant relationship, and we want people to know if there's something that you might be asked to leave or evicted, you know, for under these conditions, is that something that has been clearly communicated as you're making that agreement to move in? You know, we don't want anybody to feel like they're losing their home and they didn't understand what their obligation was.
Okay, and another question comes from Celeste. In order for people to have more choice in programs and places to live where they live, are regional centers going to seek additional providers? Will regional centers receive additional funds to do this?
So, great question. In the Community Services Department, we are always working on development for new services. We're always interested to talk to any provider that has a proposal about what they would like to offer. We really want to make sure that what we're spending time working to develop is going to meet the needs that are out there. So this is where it's essential that people who receive services are talking to their planning teams and are talking to their service coordinators about what they need and what they want. So it's one thing, you know, to say we need more day programs. It's another thing to say we need a day program that teaches computer skills for work, you know, in the computer industry. We need a day program that can support people who want to work with animals, or who want to work on literacy, or who want to work on, you know, health and nutrition and exercise, that kind of thing. If there's specific goals and needs, you may have a day program and you might like it. It's great staff. I love the peers here, but it's not helping me take steps towards my ultimate goal. We want to look at that as an unmet need so that we can work on developing something that will help you meet that goal 5 to 10 years from now.
Okay, thank you. And Amanda made a comment in the chat that says a lot of her questions revolve around resources and capabilities. They're in a rural area. Our staff and general resources are limited. In theory, providing everything people need is a great idea, but it's very hard to do this. We don't have a lot of money. Even our mileage rates for transportation are frozen at 25 cents a mile at Alta. How can we realistically provide what is needed if we can't afford to?
So these are good things to talk about with the planning team. I feel like I need a buzzer, like talk to the planning team, like with those easy buttons. That's why I talked about within the surrounding community, right? You're not going to have the same resources in Sacramento as you are in Yuba City as you are in Truckee, right? There's different things you have, there's different things you don't have. Access to transportation is a big difference in downtown Sacramento versus the more rural areas. So you have to talk about what it is that you want and what are the trade-offs in order to make that happen. You may want to live in a rural area because that's where your family is and it's important to you to be close to your family. That might mean giving up the amenities of a bigger city, right? And you may make the opposite decision. You may say, I really need to have, you know, the bus, you know, right outside my apartment, to have school right there, be able to walk, you know, everywhere I need to go, and, you know, have everything that downtown Sacramento offers. But I'm going to give up, you know, living here in this place where I grew up. There's trade-offs there. You know, personally, I've moved houses to be closer to a job, and I've changed jobs to be closer to home and not commute as far. So, I mean, you and I, like, we all make these decisions, these trade-offs of what's more important to us, you know, at a specific time, and that can change at different points in our life. But yeah, it is hard.
Okay, and Cody has a question. Does the final rule provide the opportunity for SLS vendors to attend their program, to amend their program designs? Would our rates change so we can provide more individual care?
That would be a great discussion with your community services specialist. You can always approach CSS about making an amendment to your program design if you feel that you need to make changes to your services, or if you feel like things have kind of changed and it's not aligning really well with what we had originally designed it to be. I don't know about rates. You'd have to talk to them about that. I know a while back there was a decision about the board and care homes having rates for a maximum of 4 residents to make that as financially sustainable as a home for 6 residents, so that it's more individualized, but providers aren't going to be losing money by offering that. So I say it depends on what you're offering and what the services are going to be and how your rates are currently set up, which I don't know. So reach out to your specialist.
Yeah. Okay, and Shelley offered a comment that Alta Regional Center does have Prader-Willi residential care homes available. Thank you, Shelley.
And I think we may have skipped over a question from Amanda Lauder about ILS and PA.
Thank you.
If we're already doing that based on the client's needs, then we would already be HCBS compliant, correct? Most likely, I would say probably. I don't know your services specifically or your participants, but if the service is designed to be individualized, it's a one-on-one support service, you know, most likely you are providing that in an individualized way. DDS is presuming those to be compliant at this point and are not asking those service providers to go through the extensive self-assessment process that the congregate settings are having to do, like the day programs in care homes, that kind of thing. So just because it's individualized, does that mean those individuals are always having their choices met and promoting independence? Maybe not necessarily, you know, hopefully at your agency, and it sounds like you're doing a great job, but it is always good for all providers to go back and say, are we really doing this as person-centered as we could? Is there anything that we need to change or want to make an update to, or maybe we're doing it good, but we could do it even better. Maybe we're doing it great, but it hasn't really been documented in a way that we could show in an audit. So how can we start working on that? Good question.
Yeah. And there's another comment. You mentioned about program the program to ensure goals are met, but the client wants to stay in the program because of good relationships with the staff. How do you deal with that in terms of respecting the choice of a client?
Yeah, so that's not uncommon. I'm comfortable here. I'm happy here. I like the people I'm with, right? If you're in a job and you love your coworkers, you're not likely to want to leave, right? I think there, you talk about the goals already being met. Well, what additional goals could we look at going forward from here? We've come this far, but now what it is that you want to learn, how do you want to grow, what do you want to accomplish? I think we can always be setting that next bar, you know, the next goal to keep growing personally. Very good.
Yeah.
So we talked about some of those different requirements that are outlined in the final rule. You may see as a service provider or participant, some of these things might be going really well in your life. Some of these might be a challenge, and it might be for a reason like we don't have a van or public transportation or, you know, those things available to us. There might be very many different reasons, but we're going to launch another poll in just a moment here. Thank you, Sonia, to ask which of these, in your view, where do you see the need for the most improvement? Where are the biggest challenges with how things are set up currently?
And the questions in the poll are, which of these in your view needs the most improvement? It is multiple choice, so you can opt for more than one answer. The first is community inclusion. The second is person-centered planning. Third is rights. Fourth is independence. And fifth is choices. So which of these needs the most improvement in our community? This is really helpful because we can then look at additional trainings, additional grants to focus on these areas, other efforts to help our communities be more inclusive and be more open to a variety of opportunities. So thank you for your input. Okay, 10 more seconds here. Okay, there you go. Can you see that, Katherine?
I can, thank you. Okay, so the most was community inclusion at 60%, and these were multiple choice, so you could have more than one. Person-centered planning, 44%, rights, 13%, independence, 18%, and choices, 53%. So really, community inclusion opportunities and choices seem to be standing out as the places really needing the most improvement. So I would love to talk with each of you and see, are you talking about the choices that you have, and are you happy with them? What is it that you want to do, or what do you think would be better? What do you need? And is that something that is being communicated in the regional center so we know that these are things that we can be developing or helping you get on waiting list for things that are already out there? I'm really happy to see that rights doesn't seem to be as big a concern for a lot of you as some of the other things. Obviously, we can always keep growing in all areas. So thank you for your input on that one, everybody. All right, I'm going to go back to sharing my screen in just a moment here. And we'll move on. We just did our poll. Okay. So when changes were first being discussed, you know, when this came out, 2014, 2015, there were a lot of concerns. People had some fears, you know, legitimately so. What is this going to mean? You know, maybe I'm happy with how things are now. Am I going to lose my day program site? Am I going to lose the place that I live? You know, are they going to be taking things away from me? And I really want to reassure you that I'm not seeing that to be the case. I'm seeing people really making a good effort to offer more choices and to really create more energy in promoting community inclusion, more opportunities for employment and volunteering, and really trying to do a good job with that. We're looking for more and not for less. We see benefit with what the final rule is saying because we do want everyone to have access to the benefits of community life, to have control over their personal resources, to have protections in place for their rights, to really ensure that services are received in a natural setting while still meeting their needs, to provide opportunities for personal growth in addition to required care or supervision that may be needed, to see that the planning team really has a strong voice in saying how services are going to be provided, where services go to the people who really need them. And we're seeing as these changes are being made, staff are being motivated to find a lot of meaning in their role. So as I've been watching these changes be implemented over the past several years, it's been really cool to see some of that fear subsiding about, you know, what's going to happen to, wow, good things are happening. So change, I mean, just that word, change could be uncomfortable. Change can be scary sometimes. You don't want to lose the things that are good. I did have a provider tell me things started changing for him when he started talking about, instead of calling things changes, he was calling them improvements. That's really our goal, right? We want improvements. Improved training, you know, for person-centered planning. Yes, we know we want to do it. How can we do it better and really know if we are doing it well? How can we improve having an outcome-oriented focus so that people are making progress, you know, in the areas of their goals and their dreams? How can we improve our inclusion in the community? And how can we improve documentation? Can be a challenge, but it is important. As far as offering people additional choices, there are different ways that that can be done, right? There may be different settings where those services could be offered. There could be additional focus on building relationships. You know, are you volunteering with an organization in the community that you're passionate about? It might be a choice about where you live. The final rule says that people can choose to have a private unit for living if that is what they're choosing to do. It's not requiring that care homes provide single rooms for each individual, but that might be a discussion about, would I rather move so that I can have that privacy that I want? Option for living and receiving services in an apartment or your own home, and the opportunity to work and receive employment supports in a job in the community. So sometimes people will ask me, well, when does the final rule take effect? It's not till 2023, right? We don't need to wait till 2023. In fact, please don't wait until 2023. Now is the time to be having the conversations in the planning team. Let's talk about what can we be doing better and what would it take? You know, what would that first step be? We don't have to have it all figured out right now, but we can start taking one step at a time. Okay, any other questions popping up at this point? You know, we've had some suggestions, some ideas. Maybe you've had some other questions come to mind.
Yeah, I don't see anything in the chat, but if anybody would like to ask a question, feel free.
I
Well,
just
you've got
muted myself.
Katherine.
I was typing, but it's easier just to talk.
Okay.
This is Patty. You know, more choices mean more money and the options. And of course, I'm from housing now, and housing is my focus. So, and there's so limited options for people to really have true choices as far as where they want to live. It's just, that's the way the situation is, unless we get more money and more housing options.
Yeah, housing is definitely one of those areas where your choices are impacted significantly by the resources that you have, right? And that's where, I mean, we're looking at our budgets. We're looking at what are the options that are out there, what's the best way to utilize the resources that we have, and how can we be advocating for more options as well. You know, you know, I have my own budget. I have to look at when I'm going to be choosing where to live. I like this area, but can I afford it? I like that kind of house, but can I afford it? You know, so some people may make trade-offs. They may look at an area that has a lower cost of living. People may look at, you know, if I move in with some housemates, we can share expenses and make things more affordable that way. You know, people have different things that are more important to them. You know, is it the money? Is it the privacy, location? But yeah, I definitely appreciate your input.
Or if you have Section 8, this is Rick Hodgkins, by the way. And by the way, if you want to talk about already meeting the requirements long before 2023, STEP is ahead of the game, everybody.
Thank you.
All in ILS, SLS, and vocational.
I wanted to share a quick example of a friend of mine whose son was on a waiting list for a, I'm not sure what you call it, but subsidized or lower income apartment, which is a great place in Sacramento. Well, this required, after a year of being on the waiting list, he got accepted right in the middle of COVID. And because it's such a great opportunity, they're going to go ahead with it. And that means he's having to move from a rural community where he knows everybody and knows, you know, and near his family, to move to Sacramento to be in this one apartment that he had been waiting for a year to get into. And for him, that will allow him to be in a community where he can walk to things, he can take public transportation, he can go to community college, he can look for a job, he'll be in the midst of, you know, where there's a lot of people that he can become friends with. And so for him, he had to, you know, balance those two, of being in a rural community that he also loved with being in a community where he'll be able to be more independent with appropriate supports. So we do have to make choices. There is a shortage of housing, but there's also some incredible housing that has waiting lists. And so we always encourage people to get on those waiting lists, because sometimes your spot comes up and it's like winning the lottery. But there are some amazing places. And if you get selected, it, you know, obviously can change you or your family member's life in having a different opportunity. So while there is a shortage, there are some opportunities. So even if a place says they have a 1 or 2 year waiting list, go ahead and get on that list, because sometimes your name gets called.
That's what Sonia, exactly. That's what I always tell people. Don't get discouraged. You know, they'll say it's 1 or 2 years long, but they take the top 10, send letters. If you don't respond within like 8 days, you're off the list and they're on to the next 10. So yeah, you're right.
Katherine, I wanted to ask another question about, and it was kind of ties in with what Rick was mentioning about, like a home where they only serve individuals with Prader-Willi. And one of the, and this is maybe more related to residential settings, but sometimes we have settings where everyone is at a similar level of needing supports because of the structure of homes or because of the structure of a day program. And so how do you balance that with having a group of people who all have similar support needs, with trying to be individualized and having more of a variety, and having people not be in a group with everybody being at a similar level of support need?
I think it comes down to the choice of the individual receiving the services. Nobody should feel like they're being placed in a home for a diagnosis if that's not where they want to live. That should be something that they're choosing to do because they want to be there. You know, some people may like feeling like they're with peers. They have the same challenges I do. We understand one another. We have the same support. We can encourage one another. Like, we get it. You know, they understand me. Other people might feel like I'm being labeled with a diagnosis and I would rather be an individual. I might rather be known for, you know, my skill working on a car than my diet. Right? So some people might thrive in that kind of setting. Some people might hate it. So that's why it has to be their choice. And there needs to be really good discussion and documentation about this is what this person wants, you know, as well as seeing that it will meet their needs as well.
And I see a question came in the chat from Rashima. What expenses will be provided through the regional center for all the change and specific and special accommodations for each person will need through HCBS? What funds will be provided in that case?
So it may kind of depend on what type of things you're asking about. There has been opportunity through the state budget where DDS has providers apply for funding. They call it HCBS compliance funding. Usually that's posted in October. And so keep an eye out on the DDS website or at the vendor forums to see the next time that it's announced. We've had care home providers in the past get selected for funding for purchasing a vehicle to make it easier to access the community. We've had providers be given funding for remodeling a restroom to make it accessible for the non-ambulatory residents of the home, so increasing accessibility. We've had people get awarded funding for training and certification in person-centered thinking training, so that person-centered planning is happening well in that setting. So there's definitely lots of good options there when it's benefiting the residents as a whole. If there are specific needs, that could be met maybe through the IPP process. If it's an individual's goal that needs to be met, talk to your service coordinator and see what that might be. If there's an individual who wants to be out and about in the community more, but transportation has been a challenge, maybe they could do funding for a bus sticker and some mobility training so that they can learn how to access the community on the bus. That's something that you could do through the IPP process. Talking about the generic supports, right? Things that you might be able to access through the community, through friends, neighbors, things that are out there. So it kind of depends on what the specific need might be, how you would approach that.
Good. And I don't think I see any other questions or comments in the chat. Oh, just something just came in. Hoping that PCP will be included in the DSP's training, the direct support professionals training.
Mm-hmm. Yeah, I really hope to be making person-centered thinking training available through the regional center, both with our staff and providers and community members as well. I don't have a date on that yet because we're looking at how are we going to transition from in-person offerings to the online format. But that's something that we definitely encourage people to take advantage when they can find it wherever you can. All right, I'm going to go back to sharing my screen.
Okay, good.
So we're going to talk about some challenges. What are some hurdles? What are some barriers that we've found? Transportation has come up, finances, resources for where you're going to live, that has come up. We might have limited options as far as choices, housing availability. And feel free to share some of your barriers in the chat box if you like, as we're having, this conversation. We recognize the more transportation you have available, the easier it is to get out and about and access community resources, right? If you don't have that, that can be a barrier. Ratios, if you are on a day program site and it's a 1-to-8 ratio, it's going to present some challenges in individualization of services. It's going to present challenges in transportation because how does one person transport 8 other people? When you're in a store together, are you taking up all this space in the store? So that's something that a lot of providers are looking at right now. Rates, we know that rates have been historically lower than what a lot of people feel they need to be able to offer, the services for the client's goals, to the extent that they want to. That's a discussion. Location, if you are in the middle of nowhere, it feels like, if you are dependent on staff transportation, if you can't walk to community locations, that's going to impact what it is that you're able to do and how you do it. And also expectations as well. Maybe even in the community, right? We're talking here about we want people to be included. We want full integration. You may have an experience like, I heard a story about a program who was really trying to help their participants engage, and they helped them sign up for a class at Joann's. I think it was sewing or some kind of arts and crafts. And so now they're part of a community sewing class. This is really what we are encouraged to see with the HCBS, right? Well, Joann's came back to the the day program staff and said, you know, do you want us to create a class for your clients? And I think Joanne's was trying to be sensitive, like, oh, can we do something for you? They're trying to be helpful, but it was counterproductive. Like, no, we want to be with people outside of our program. We want to be taking a class with other people in the community. We don't want to be separated out of the class for the day program people, right? We're people. We want to be part of it together. Participants may have their own expectations about what they do and how they spend their time. And some people may want to be more out and about in the community. Some people may have anxiety about that or not sure what that's going to mean for them. And that's okay. Family members, you know, they're strong advocates for their loved ones. And a lot of times, parents especially may have a concern that I want my child to be safe, right? I want to make sure that they have the protection and the supervision that they need, which as a loving parent, of course you have that. And then we're also trying to balance that with how are we balancing safety and also promoting independence as much as possible without taking on too much risk. So navigating that, you know, can be some hard conversations sometimes. So we acknowledge that those are challenges. You know, there's not always easy answers, but we're at a point of having conversation. You know, what does it look like for you? I think it's really good that this is about individualized services. It's not saying, you know, you have to do this thing, you know, one size fits all. It doesn't work that way. So we're trying to make sure that people do have those choices and that that support that they need. Tips. All right, person-centered thinking training. I love it. It's so valuable. Everyone I know that's done it has gotten something out of it. If you have opportunity, I really encourage you, your staff, your family, everybody to go do it. Ask the question, what would it take? A lot of times, it's easy to want to choose from the menu of what do we have? What are my choices that are out there? In my role, sometimes I will get phone calls about someone interested in a day program opportunity, and they'll say, well, what vacancies are there right now? Like they want the list of where there's a vacancy. And I'm always perplexed, and I say, well, what do you want to do? How is it that you want to spend your time? If there's a vacancy in the art program, but you hate art, it's not going to do you any good. So we need to start with, what is it that you want to do? Do you want to get a job? Do you want to work with animals? Do you want to be creating? Do you want to be active? What is your specific goal, how you want to spend your time? It might be something, you know, big. I want to be an astronaut. I want to be a rap musician. Okay, I don't know if I can make those things happen for you, but to ask, what would it take to start moving towards things that you're passionate about, right? We can look at music, how to build more music into your day. We can look at space and science and being more part of that world. I don't know how far it's going to go, but that's not up for me to say. But if you're setting the goal, that's going to set the course on helping you to get there. Don't hold back. I know sometimes providers especially feel overwhelmed. There's so much to do, especially right now, right? Like we're all adjusting. Connect with others. You know, we have vendor forums at the regional centers so you can meet with other providers. Talk to one another, share your ideas, share your questions, you know, reach out to community services, reach out to me. You're not alone in this. Start now. Don't wait till you have it all figured out. You know, it might be we're updating one IPP goal at a time, you know, to really look at this. How can we make this the best we can? You don't have to do it all in a day, right? We've got time, but if we start now, you know, that's what it's going to take to get there. For providers that have a setting, it's not wrong to have a setting, but we want to make sure we're using it optimally. It's a place to empower, to launch into community inclusion, not to stay and be separate the entire time. Be looking at accessibility, and this isn't just you know, having a restroom that is accessible to people using a wheelchair. It can be anything that is making participants more independent. If there's anything that staff are doing that the participant could do it if they had the right accommodation, let's look at getting that accommodation so that we're promoting independence. Prioritize developing and maintaining relationships. This can be really hard for people receiving services sometime, and it can be back burner. And I know a lot of times I'll hear about the, community care licensing audits where they're coming in and they're taking the temperature of the hot water, but they're not necessarily asking, and how about you? Do you have friends in your life? Do you have someone that you can call when you're having a hard day, or someone that will give you a hug when you're upset, someone to call and celebrate with when something good happens on a good day? Those are hugely important quality of life issues that need a greater focus than they've gotten in the past. And I'm really hoping that with the implementation of Final Rule, people will feel more supported and have these opportunities for strong relationships with family, friends, coworkers, community. And we all need to be looking at how we can support that. And broadening that idea of community, it's not just going out of the building, right? It's relationships, it's connection. Success stories. I am so thrilled when I get reports back from providers. I wasn't sure about this. I tried it. I didn't know how it was going to work, and it has been so positive. I've gotten so many great reports, you guys, and I wish I could bring them all in here and have them all share with you. We have providers that would share concerns at every vendor forum. I don't know how this is going to work. I'm worried about how this is going to go. Coming back and saying, people are feeling more independent, people are growing more confident, staff are getting more motivated. Sometimes change is slow, right? We had a day program where traditionally services were all provided only on site. They got some vehicles through one of those grants, and they started offering opportunities for volunteering activities out and about. And sometimes some individuals would sign up, oh, I'm going to go. And then the day of, no, I don't think so. I don't feel up to it. Because change is hard. And it was uncomfortable, when I'm used to being on one site every day with these people that I know. Sometimes it's hard to break out of that comfort zone for months. But over time, oh, I'm seeing my peers start to go. They're having fun. They're coming back and having great stories. And I think I feel ready to try that too. So sometimes the momentum is slow, but it does pick up as you go. We've heard about people living in a care home that are building relationships with neighbors, inviting them over for dinner, getting to know them as individuals, getting invited over, being reciprocated. And so now there's relationships developing there. People feeling more secure, better relationships with their housemates when they're able to lock their door and their housemates aren't coming into their room unannounced or getting into their belongings. And people getting jobs, having opportunities to work and to volunteer and doing things that they're excited about. So what do we do with all this? It's a lot of stuff. It's a lot to know about, but it's nice to have a takeaway, right? So what are we going to do from here? In your role as a provider, as a service coordinator, a person who receives services, a family member, what is it that's going to be the next thing that makes sense for you? Is it a conversation with people that you care about? Is it getting some training about person-centered thinking and planning and getting some tools to kind of put services together in a person-centered way? Is it identifying some of those goals and being able to make sure it's documented in your IPP? What are the steps that need to be taken, and how do we include that? And getting involved, being here is a great way to be part of a training. There's trainings coming up with DDS. I've got my training next month. If there's needs that you see for training, please reach out and let us know. I know Sonia's always happy to hear that, and I am as well. So many ideas, so many things you could be thinking about. What is one thing that you can start taking home and working on today? Please, I hope each one of you will comment in the chat box with one idea about what it is that you would like to do to be implementing this in your own life, your own setting. I'm going to stop sharing just for a moment because I want to see some of these comments pop up.
Yeah, everyone, please feel free to speak up. Oh, I see one chat.
Okay, a couple questions about the current COVID-19 restrictions and what does this look like right now? Good question. That was something I was thinking about quite a bit as we were transitioning to shelter in place, and now I'm at home. We're all at home. You know, I've been talking so much about community inclusion and connection, and that's a real big challenge right now for everybody. So I think it is helpful to remember that the final rule is about people who receive services having the same access as anybody else. So with COVID, we are all kind of in the same boat. We are all trying to find ways to stay connected with phone calls, Zoom. We're limited in being able to spend time with our friends, limited in being able to go where we want to go. So that is kind of a normalizing experience that we can acknowledge. That's not something that's going to be counted against a provider, that they're not necessarily offering something. So finding ways to do those things virtually, it sounds like you're already doing a lot of Zoom and video. That's wonderful. Keep it up. Meeting the individuals where they're at, right? It's about individual need, individual choice. You know, also being mindful of health and safety, and those are going to be changing. We're always assessing, right? Even in normal times, we're updating the IPP, we're seeing what the needs and interests are. That's going to continue. They might be different things than they were a year ago, but we still have the same process. So be encouraged with that. One thing I am seeing is that COVID has kind of forced us to look at the costs and benefits of congregate settings, right? There's been benefits in the past. You know, there's definitely a lot that they offer. There's a lot of good things about them. And we're seeing there's maybe greater risk of spreading disease. And so while HCBS has forced us to start talking about individualization of services, COVID is also showing us that there could be health benefits to that as well too. So I think it kind of goes hand in hand, you know, being able to provide more individualized services and, you know, less of a dependence on big congregate settings. So that is really prompting DDS to look at how are we going to be reimagining services that are safe for people during COVID, but in doing that will also be more individualized and also fit well with the final rule requirements. Interesting times. Training on person-centered goals. I would love that. That is a fantastic suggestion. Oh, lots of good comments coming in. Ensuring people have a say in all they do. Yes, Sonia?
Yeah, I was just going to say, I'm going to launch, everybody's typing away, so that's great. For those who are finished, we're going to switch over to our final poll, and that is a satisfaction survey. And then we'll keep going for a few minutes on questions. So the first question is, did you learn something? Whoops, I didn't launch it yet. There you go. Did you learn something about HCBS and what it means for services and supports for regional center clients? And the second question is, are you satisfied with this training on the HCBS final rule? So we appreciate your answers to those questions. That's something we need to provide to our federal funders, because I want to hear about the trainings we're providing. So along with that and the registration questions that you did when you registered for this training. So I appreciate your participating in that. That's valuable information for us, and it will all be anonymous. So I'm going to leave the poll open for a couple minutes, and people can continue to type in their comments. These are really helpful. And turning it back over to you, Katherine.
Oh, good. Thank you, Sonia. Yeah, listening, talking, having these discussions, I'm hearing that a lot. Wonderful. For people who are having concerns about transportation and how that's actually going to work out, please email me and we can talk about that more specific to your exact location. Ask, don't assume. Wonderful. Sharing HCBS information with caregivers. I really appreciate that. You know, I do hear from time to time, people are not talking about this a lot in their IPP meetings. And I appreciate the challenge because it's not like you can just check a box like, oh, we did HCBS. You know, it's not that we just signed this form and we did what we need to do. It's really that person-centered approach of, are we really talking about what's important to you and important for you beyond, you know, is there a vacancy in this day program or that day program? And sometimes people may not even know if they haven't ever been asked that before. People may not be sure, they may change their mind. There's a lot of reasons. So I think just even starting to ask those questions, have you heard about the final rule? I can give you some handouts I linked to on that resources page on the website. So I would encourage you to go check that out. If you need information to hand out, I can email that to you directly. Just reach out for that. Videos, there's a question about recommended videos. Yes, if you visit the website hcbsadvocacy.com, they have links to resources. They've got an HCBS toolkit, and there are some videos created. They look like they may be designed for the participants to explain, you know, this is how it may affect your services, maybe like 8 minutes long. They may be really helpful for staff as well.
And just to point out that this is not a new concept. California is working on it right now, but other states have already been working on HCBS for many years, and some of them have completely gotten into compliance. So this is not new. We're not the only state who's working on this. I also wanted to point out that in the poll results, if you didn't feel like you learned anything or you are not satisfied, please feel free to reach out to me. Please feel free to email me if you have specific questions. We can certainly provide more information like Katherine said. You can also sign up for the next training where we'll talk more about residential settings, and then also the third training where we will focus more on the individual receiving services and supports as well as family members. And that will be a little bit of a different angle to all of this, but we appreciate you participating today. So please always feel free to reach out. Also share in the chat any comments about today. A couple people have made some comments about what they enjoyed learning today. For many people, it's the first time they've heard this information. And again, this is just the beginning. We'll continue to share this information as much as possible. Sometimes when you bring in a new concept with acronyms, it's really hard to get people to participate because they just don't even know if it applies to them. But really, this does apply to everybody. So thank you for being here today. I'm turning it back over to you, Katherine, if there's any comments or questions.
Great. I saw a question from Amanda Lauder that I'd like to discuss, and then I've got just a couple more slides before we finish up. So Amanda Lauder asked, how does person-centered planning come into play when you have clients who are conserved and parental conservators overpower the client and try to overpower the provider? Excellent question. This can be a uncomfortable situations sometimes for providers or different members of the planning team when they're maybe not sure about the role of the conservator or the powers that they may have. I always encourage people, if you are a service provider, make sure you have a copy of the conservatorship papers. There should be the letters of conservatorship that will explain exactly what rights are assigned from that individual to their conservator. It is very rare, in my experience, that someone has a full conservatorship over every decision that that individual might make. Usually it's a limited conservatorship where there are certain powers that are assigned. So it might be in relation to finances. It might be medical decisions. It might be relationships. It might be contracts. So a judge may assign some or all of those powers to the conservator, but maybe not all. So knowing where does the conservator, legitimately have the authority to make a decision on behalf of that person, and where it may just be their preference, but they don't have the right to make that decision. A conservator has, they may have the authority to make a decision about this client will receive services in this day program. That might be the decision they make. They don't make the decision about what's in the program design. So they're not telling the provider exactly how to run the program. If the program design is in place, the conservator can choose, if they have that authority, is this the place where the person will have services or not? But the development of the individual program plan and the ISP is going to be driving the services that are received there. So great question. If you have specific situations you'd like to run by me, feel free to reach out. Definitely let your service coordinator know. In the past, our legal specialist, Robin Black, has given some excellent trainings on conservatorship for our providers. So if there's a need for that, maybe that's something we can ask her to do again via Zoom sometime. It's very interesting and very helpful for people working with someone who's conserved. All right, I'm going to go ahead and share my screen as we finish up here. So I want to thank Sonia for sharing this graphic with me. Really helpful for me as a visual person to see the different ways that people experience relationship with one another. If you look at the top left, this talks about exclusion. And this might be something that people experience decades ago. There weren't services. People maybe lived at home with their family member. Maybe they didn't have any support at all. They were kind of on the outside of society. And there was a recognition that, you know, some people do need better care. They need better support. We want to give them what they need. And they thought that that might best take place in an institutional setting. And that's where you see the small circle on the outside. As you know, there's quite a history there. This was not delivered the way intended, and institutions weren't necessarily the best way for that to happen. We see that there's a lot of advantages of community life and being a part of the community. And so rather than have people in institutional care, bringing them back into community, integration is when they're in that big circle, but there's still separation. It's not fully included. And if you look at the bottom right, we want to see full inclusion where people who may need some support are still part of their community. They're connected, they're contributing, and they're enjoying life and the full benefits of what the community has to offer. So hopefully our discussion about the final rule has given you some ideas about how you can do that and be a part of that in your setting. So change, I love this. Who wants to change? We all want things to be better, right? You know, we've got vision. We don't want to see these barriers in place. Who wants to change? Ooh, once it's up to us, what steps are we going to take to overcome those? It's tricky sometimes, but we are in this together. You have support. We've got great vision. We've got great reasons and great people to work with. So that is the conclusion, you guys. I'm happy to take more questions, you know, for a few more minutes. You can add those to the chat or feel free to unmute yourself and talk, but I'll leave up my information here. You're welcome to call or email me and reach out about anything having to do with the final rule anytime. Thank you, everybody. Great talking with you. I appreciate it.
Thank you.
Thank you. Have a great day.
Thank you, everyone.
So have a great day, everybody.
Thank
Stay
you.
safe.
Thank you.
Have a nice weekend.
You
Thank
too.
you.